So for the first thing I'm going to do while changing a dressing is I'm going to enter the patient's room, perform hand hygiene. I'm going to close the curtain to ensure the patient's privacy. I'm going to gather all my necessary supplies. Now I'm going to verify the provider's order, introduce myself to the patient, make sure to identify the patient using 2 identifiers. While I'm looking at the wristband, I'm going to ask for their name as well as their date of birth. Going to ask them on a scale of 1 to 10 how bad their pain is. Going to explain the procedure I'm about to perform, as well as ensure that the patient agrees to this treatment. If there is a risk for spray, I would apply my gown, my gloves, my goggles, as well as my mask. Now what I want to do is I want to position the patient in a comfortable position, making sure to only expose the area that I will be working with. I'm going to instruct the patient not to touch the wound, nor the sterile supplies I'm about to use. And then I would get my biohazard bag, making sure to cuff the top part and put this in an area within my reach. Right there. Now what I'm going to do is that I have all my things ready, I'm going to apply my clean gloves. And while I take off the old wound dressing, I'm going to make sure that I pull the tape parallel to the skin and pull in the direction of the hair growth. If necessary, I would ask the patient if it was okay to shave the area as needed. So what I'm going to do now is one by one pull off these layers, making sure that the patient does not see the soiled end. I'm going to inspect, folding it up. Since there's only one piece, I'm going to go ahead and just fold that into my gloves and dispose of my gloves. Now I will go and perform my hand hygiene. I will put on a new clean set of gloves. And now I want to inspect the color and the integrity of the wound. I want to palpate for any edema. I will assess any sort of odors that I might smell, as well as loss of skin integrity. Now that everything seems to be in order, I'm going to head and take off my gloves. I would have also, if indicated, measured the length, width, and depth of this wound. Now I'm going to go ahead and perform my hand hygiene and set up my sterile field. Making sure to only touch the outer inch of this, as that is not sterile. I'm going to apply my sterile gloves. Now that everything is ordered, I'm going to go ahead and cleanse the wound. Making sure to clean from least contaminated area to most contaminated area. Dispose of that. And if it was ordered, I would apply an antiseptic ointment. Now that it is clean, I'm going to blot dry, making sure that this is dry. Now, for applying the new dressing, I'm going to apply a loosely woven piece of gauze first. Now I'm going to apply a thicker piece of gauze, securing this with tape. Now I want to make sure I label with my name, the date and time. I'm going to go ahead and take off these gloves, dispose of them, and put on new clean gloves to get rid of all of my used supplies. Hand hygiene. Make sure that the patient's in a comfortable position. Make sure that the call light's in reach. Going to lower the bed, raise the 2 bed rails. And I'm going to ask if they need anything else before I leave the room. I'm going to go ahead and perform hand hygiene one more time, and then I'll leave the room.